The GOP's latest attempt to repeal and replace the Affordable Care Act came up short. The last plan, co-sponsored by Wisconsin Republican Senator Ron Johnson, would have taken money being spent on the ACA and turned it over to the states in the form of block grants. The ACA, also called Obamacare, remains in place, and a new enrollment period for it begins on November 1st. But there's still a lot of uncertainty about its future. So how are hospitals and providers dealing with that? We're asking Dr. Nick Turkle, President and CEO of Aurora Healthcare. Dr. Turkle, good to have you on the program today.
Thanks, Mike. Good to be here.
So how is this continuing uncertainty about the future of Obamacare affecting Aurora Healthcare system?
Well, healthcare in general is just in such turmoil right now. I think I would first say I think in Wisconsin we might be in a better position right now than many folks around the country, but we're very concerned about the future. We can do what we do well right now today, take care of patients. But I worry that patients have gotten lost in the discussion that's going on right now in Washington, and what we'd like to see is a bit of stability going forward.
When we talk about stability, one of the things that seems to still be in play is the decision on whether or not the government will continue to fund the cost-sharing reduction payments that allow low-income people to have access to health care, allow insurers to get paid.
Yes.
There still seems to be some question about that. If for some reason the government were to pull back from that commitment to those payments, what would that mean for your hospitals and others?
Well, first of all, let me talk about what it would mean for our patients, because we're most concerned about what's going to happen with people losing coverage and going back to a time when they used emergency rooms for primary care services. That's not good for patients. It's not good for us either. If you look back at the ACA, we had a 37% reduction in uninsured in the state of Wisconsin. About 200,000 people got insurance coverage. We would hate to see that go away. So stabilization of those credits is particularly important now. And whether that's going to work long-term or not, we'd like to see a short-term stabilization so that some real long-term reform might happen, hopefully in a bipartisan way.
Are you still optimistic that, for example, the conversation that's been occurring between Republican Senator Lamar Alexander and Democratic Senator Patty Murray about at least a short-term stabilization bill, are you still optimistic that could happen? And why do you think a bipartisan solution is the key here?
Well, so to answer the first part of the question, I'm an eternal optimist, and I think this country has to figure out healthcare at some point. I think the bipartisan discussion about stabilization right now is critical. I think that will continue because our elected officials are worried about their constituents, as they should be. I think it'll get solved short term. The reason I think bipartisan approach is so important to a long-term solution is that if we look back at healthcare or any major legislation in this country, anything that's been done in a completely partisan way tends to fail. So we look back at Medicare. It was a bipartisan effort, and I would argue it's done a pretty good job for our seniors in this country through the years. The Affordable Care Act was always partisan, always partisan. So now the response is partisan, and this ping-pong ball effect with healthcare does not serve people well. I think this is too important an issue to remain a partisan discussion. We have to have a bipartisan solution that says, how do we care for the most people, the lowest cost with the highest quality, and make sure they have really good access to care?
You talk about the fact that you feel a bipartisan solution is necessary. We seem to, when we discuss health care in our country right now, we do very quickly move into partisan silos. So the question I have is, are we even having the right conversations about health care?
I don't think we've ever had a good national discussion about the fundamental things that we need to do in healthcare to change it. This is an industry that needs reform. I've said over and over that we welcome reform. We think we spend too much on healthcare in this country. We think there are ways to manage populations more effectively, to take cost out and improve quality. And that's the discussion that would have to be had at the national level in a bipartisan way. There are solutions to it. We know much more now than we knew a generation ago about how to manage populations. So individuals with chronic disease, for example, they consume a great deal of the cost in this country. Better management of those chronic diseases in a proactive way reduces the cost and gets better outcomes for those patients.
Dr. Nick Turkle is the president and CEO of Aurora Healthcare. It's good to have you on the program today.
Thank you, Mike.
Appreciate it. Coming up next on Upfront, more on Foxconn and how it'll play as a potential campaign issue.